This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America. And on a fine May afternoon in 1988, I'm talking with Dr. Luella Klein, the 35th president of the American College. Everybody knows Dr. Klein as Teddy. I could hardly call you Luella. So, Teddy, tell us where you came from initially, geographically that is, and something about your education.
Okay, I was born in Iowa, and I went to both undergraduate school and medical school at the University of Iowa, and then I subsequently went to Cleveland, to Western Reserve, at that time assigned to City Hospital for internship and residency training.
Since I'm a Midwesterner, what town in Iowa did you come from?
I came from Walker, Iowa. I don't know, 400 or 500 souls, something like that.
Southwest Iowa?
No, in about the middle of the state.
Middle Iowa.
Not very far from Cedar Rapids in Iowa City.
And who was the chairman of the department at Iowa in the years you were there in school? Although that might date you a little, I suppose.
No. I think that when I was an undergraduate student, it was Dr. Ploss, and then
Dr. Keetle.
It was Dr. Keetle, and I suppose he was instrumental in my thinking that I might be able to become an obstetrician, because he was really a great gentleman, a scholar, and I think very attentive to students and what they might do in the future. And I think Bill probably was the reason that I thought it might be possible to go into obstetrics.
Nobody who knew him would not say he was a wonderful person, because he surely was. From Case Western, what happened to your career?
Well, I went to London to do a senior research Fulbright scholarship, and I was there a couple of years. I came back and...
Tell us about Fulbright.
Well, I went over there, and one of the odd things about it was that I went with Dr. Reed, Charles Reed, and somehow he was very much afraid, despite what I'd written to him, that I was interested in Grantley Reed and his childbirth education and things. But I spent about half of my time with Charles Reed and about half of it at Hammersmith with J.C.M. Brown. With J.C.M. Brown, we were looking at radioisotope studies. And I had only been there about 24 hours, and he told me, Miss Klein, go up on the antepartum ward and get me some intervillous blood. And, this was
somewhat to your surprise.
1954, 1955. And I said, well, I didn't know that I was going to be able to do that. And he assured me that I would be able to do that. And within a few days, I was spending my time collecting intervillous blood from patients on the inpatient ward. We were giving sodium-24 isotope, not recognizing in those days that isotopes shouldn't really be given during pregnancy. It's a very short-acting isotope, and as far as I know, we didn't do anybody any harm, but certainly one would not be able to do the kind of studies that we were doing in 1955, 56, 57.
And then back in this country?
Well, I came back and went to look at where I might be able to get a job in academic medicine, and in the meantime, one of the only women obstetricians that I knew had an accident ice skating, and so I did her practice for a very short time. I was offered a job at Iowa, and Duncan Reed offered me a job in Boston. But I elected to go with my husband to Emory, where he was chairman of the Department of Hospital Administration.
And started a long career.
Well, I started a career there, but I was told by the dean, and of course there was a place for me in OBGYN in the department at Emory. And the chairman of the department was out of town, and when he came back, he told me in no uncertain terms that he was not the least bit interested in having a woman in his department at Emory. I think it's a little bit of a laugh that I should now be chairman of that department.
Well, how did things go on from there? Obviously,
Well,
you got involved in the department.
Yes, I was a clinical faculty member of the department, and I was working full-time as a consultant in maternal health with the Georgia Department of Public Health. I subsequently went into private practice with one of the only board-certified woman in OBGYN in Atlanta. Subsequently went to Bristol Laboratories as associate or assistant director of research there.
Is that
I worked on policy.
In Atlanta or no?
No, I went to New York in Syracuse to do that, and then I went back to Atlanta to be a full-time member of the Department of Gynecology and Obstetrics at Emory.
Was that when Dr. Thompson?
Yes, in
was there?
1967 I went back to be a full-time member of the department, and have been a full-time member of that department ever since.
How did you get involved in college activities?
Well, my partner was John McCain, and John thought that I ought to have some activities with the OB Practice Committee and with the Teenage Pregnancy Committee. So that was the way I first got started in committee and activities with the college.
How did your various offices go that led you to be the president?
Well, I was assistant secretary. It seems to me I was retarded because I was assistant secretary several years. Then I was vice president and then president.
That was in 1985.
In 1985.
When you were the 35th
Yes.
president.
Mm-hmm.
And obviously, unfortunately, the first woman president.
Well, it was a lot of fun.
What problems went along with the role as a woman? You've already alluded to the way you weren't accepted back in the 50s in Atlanta.
Oh, I think the college was very good to me. The staff is very competent, and certainly as I traveled now from district to district, I think the college itself was very nice and very helpful, and that wasn't any particular problem. I think I chose to dwell on things that people often think are mundane and academicians often think are trivial, but which I think were important to women, because I was concerned about unintended pregnancy and sort of how willy-nilly childbearing, teenage pregnancy, family planning, how our low-income women are able to get prenatal and general care. And I think those kinds of things are not looked on very academically oriented, and I think a lot of people thought that those kinds of things were trivial, but I thought those were the things that were more important to women.
I think certainly the mark of your presidency, if anyone were to ask, would be being remembered for your activities in combating unintended pregnancy. How has that moved in the 3 years or so since you were president?
I think it's going very well. I think the networks went from absolutely saying they wouldn't take any public service announcements on unintended pregnancy and pregnancy prevention to now not only taking the public service announcements, but more importantly to have some content in their programming on sexual responsibility and the consequences of sexuality. And people even begin to mention condoms and talk about birth control and the Cagney and Lacey and LA law, a lot of things. I think on the programming, I don't think the college is really in the business of making public service announcements. What we were trying to do is to get at sexual responsibility, prevention of pregnancy. But then I think there are other women's issues like cesarean section, oophorectomy, hysterectomy. I think surgery often is a woman's issue. Now I think that prevention of teenage abortion is a big issue because I'm concerned that there are 140 pregnancies per 1,000 teenagers in California and 69 abortions per 1,000 teenagers aged 15 to 19 every year. And I think that's, sort of unnecessary. I think that college will get on to estrogen replacement therapy and osteoporosis. and breast disease. They'll get on about their business.
You've certainly been a popular figure since the presidential year, and even perhaps before. What are some of the various commissions and activities that you've been involved in these last years or two?
Well, I'm now chairman of the Department of Gynecology and Obstetrics at Emory. I've been on the NIH committee on the content of prenatal care, the Institute of Medicine's committee on low birth weight. I've just been elected to membership in the Institute of Medicine,
signal honor, indeed,
which is very nice. And it seems to me that I keep having a lot of activities of people asking me if I'll come around and talk about something, or would I come around and see if I could help them get something started.
I know you've been busy.
Yeah, always busy.
Let me ask you about something else that I think perhaps both of us feel strongly about. We're at a point now where 16% of all the members of the college are women at the junior fellow and fellow level, and yet we still seem to be very slow in getting women into leadership positions. What do you see us doing?
Well, I think that's difficult, and I think the college will have to make overt and active efforts to get women involved. First of all, I think the women membership doesn't feel sometimes particularly welcome in leadership roles. I think one of the problems is it's a prime childbearing time for women, and that they're very busy. If you practice and have a full-time job and also have a full-time job at home, one of the things you give up, or one of the things you don't think about so much, is organized medicine. Again, I think women didn't grow up learning to play games and learning to be political, and I think that both women and blacks will require, and other minorities will require real sort of recruitment, a little TLC probably, and I think that a lot of people find that unpleasant, don't want to do it, feel that when you talk about equality that's unpleasant. But I think it's very essential, because I think women, if they don't perceive that the college provides them with something or is important to them both personally and medically, and also in some representational role, and to speak on behalf of healthcare for women, then I think they may look on it like the AMA, a little bit more like a trade union, and that it's not something that they find essential to their personal activities or to their professional activities. I think women are less inclined to be political, and I think they're less inclined to participate in organized medicine. At least I find that true.
One of the comments we, seems to me, keep hearing when we say what can be done about getting more women into leadership roles is that, well, if they're only willing to wait 20 years like we did, then they can move up the ranks and be in the roles. What do you say to that?
Well, I think that's too long a wait. I think that the perceptions of women in the meantime will be that that's unfair, that it is unequal, and that women indeed probably know more about women's problems, the things that are important to women, what things might respond to their medical and personal needs. I think that's fairly important. I think most women, there are a lot of things that you don't have to be taught as a woman.
Let me, having said all those things, ask you something more about yourself. If you ever get a spare minute, what do you like to do in it?
Oh, I like to spend my time at the lake, digging around in the yard and swimming and water skiing, playing with the grandchildren, and I suppose reading for one of the things that I do for recreation. All kinds of books, mostly.
You'd probably like to find more time to do all of them.
I would like to spend more time to do all those things. On the other hand, I think one does with one's time what one really wants to in the long run.
It's certainly from the standpoint of the college, your contributions have been, and I'm not going to overflatter you, but still almost beyond measure. As the first woman president, I think you have projected an image that has made you very involved and very much sought after in addressing issues all across the country. I suspect that sometimes it must seem like pressure. Nonetheless, all of us think it's been an amazing contribution.
Thank you very much. It's been a lot of fun, and I would have to say that the college staff and the district people have all been very supportive and, really very helpful.
I just hope that perhaps some years down the road when somebody's looking at this tape on a screen someday, somebody will say, gee, is there any possibility of us getting a male president of the college? We haven't had one in so long.
Gee, I look forward to that day.
Teddy, thank you so much for being with us today. During her presidential year in 1985, Dr. Klein pioneered the use of public service announcements on television for the college and working with her campaign concerning unintended pregnancy. Now, 3 years later, as the college moves to its new building at 409 12th Street in Washington, D.C., we have a long-desired and long-awaited television studio named in honor of Dr. Klein and supported with a generous gift from Wyeth Ayers Laboratories. And I'd certainly like to thank Wyeth Ayers Laboratories not only for this contribution to the college, but among many other things, for its help with this history video series, which we look forward to retaining for many years in the future.